is the inferior part, deeper part of the peritoneal cavity. Hepatorenal recess of the Morrison is a part of the peritoneal cavity on the right side between the liver and right kidney. Okay? This is hepatorenal recess, and here is subphrenic recess. Visceral surface or inferior surface of the liver covered with visceral peritoneum, except in the fossa for the gallbladder here, and at the porta hepatis. Hilum of the liver is called porta hepatis. Here is porta hepatis. Here is inferior surface of the liver. Okay? It's covered by the visceral peritoneum. The liver is covered by the visceral peritoneum completely, except for the posterior surface. Okay? Because posterior surface of the liver attached to the diaphragm. I will tell you in the embryology of the liver that liver is a bud from location between, junction between foregut and midgut that enters into the septum transversum and then extends into the abdominal cavity. Okay? You imagine? Here is septum transversum that becomes diaphragm. This is septum transversum, becomes diaphragm. Liver bud enters into the septum transversum. Okay? And then extends into the abdominal cavity, inferior. Okay? Peritoneum that covers inferior surface of the diaphragm after entering the liver into the peritoneum becomes visceral peritoneum around the liver. But liver is a heavy organ and should attach to the diaphragm, because if separates from the diaphragm, falls into the pelvis. Yeah? It's located attached to the diaphragm, and visceral peritoneum covers the liver, except posterior surface that attached to the diaphragm. This part of the liver, posterior surface of the liver that attached to the diaphragm and doesn't have peritoneum is called bare area. Bare area. Here is porta hepatis. You see here from porta hepatis, right and left hepatic arteries enter into the liver, and right and left portal veins enter into the liver, and right and left hepatic ducts exit from the liver and attach together and make common hepatic duct. Common hepatic duct. If you remember, I told you common hepatic duct and cystic duct from gallbladder join together and make common bile duct or choledoch. Common bile duct. Do you remember that common bile duct enters into the free border of the lesser omentum, descends from posterior surface of the first part of the duodenum and from posterior surface of the head of the pancreas and enters into the second part of the duodenum. In the
Major.
ampoule of water, this common bile duct joined to the main pancreatic duct or Wirsung duct, and these two ducts together drain into the duodenal major papilla or papilla duodeni major. Yeah? Here is porta hepatis. In the inferior surface of the liver, in addition to the porta hepatis that is located transversally, there are two anterior posterior sulci. Left anterior posterior sulcus here anteriorly has a ligament that is called ligamentum teres hepatis. Teres means round. Yeah? Ligamentum teres hepatis, anterior part, and posteriorly there is ligamentum venosum. Ligamentum venosum. Okay? Ductus venosus in the embryonic period after birth becomes ligamentum venosum. Here is ligamentum teres hepatis, or round ligament of the liver, and here is ligamentum venosum. On the right side, anterior part, this part is location of the gallbladder. There is a sulcus for the gallbladder. And posterior part is a sulcus for the inferior vena cava. Vena cava inferior. Okay? This is inferior vena cava. And this is gallbladder. On the right side of the inferior vena cava and gallbladder, this part is inferior surface of the right lobe. Right lobe of the liver. And on the left side of the ligamentum venosum and ligamentum teres hepatis, here is left lobe of the liver. Anteriorly, between ligamentum teres hepatis and gallbladder and anterior to the porta hepatis, this lobe is called quadrate lobe of the liver. Quadrate lobe of the liver. And posterior to the porta hepatis, between sulcus of the vena cava inferior and ligamentum venosum, this part is caudate lobe. Caudate lobe. Caudate lobe. Caudate lobe extends to the posterior surface of the liver, and anterior part of the caudate lobe, posterior to the porta hepatis, has two parts. This part is called papillary process, and this part that extends to the right lobe is called caudate process. Caudate process. Do you remember where is the location of the Winslows or epiploic foramen, Winslow's foramen,
Lesser omentum.
or omental foramen, or epiploic foramen.
Right side of the lesser omentum.
Yeah. Right free border of the lesser omentum is located on the anterior part of the Winslow's foramen. Do you remember? Winslow's foramen is between lesser sac and greater sac, between bursa omentalis and greater sac of the peritoneum. Do you remember? Yeah? I told you. Anterior border of the Winslow's foramen is formed by the free border of the lesser omentum. And in the free border of the lesser omentum, there are three structures. Common bile duct, hepatic artery proper, and portal vein. Yeah. It's our anterior border of the Winslow's foramen. And posterior part of the Winslow's foramen, inferior vena cava. Inferior border is first part of the duodenum. And superior border is caudate process. This process. Do you remember? Okay? Anterior part of the caudate lobe, anterior part of the caudate lobe has two parts. Papillary process posterior to the porta hepatis and caudate process. Caudate process attached to the right lobe of the liver and is located superior to the Winslow's foramen. Superior to the Winslow's foramen. Liver has many relationships. Esophagus is located posterior to the left lobe. Posterior to the left lobe. Right anterior part of the stomach. Anterior surface of the stomach on the right side. Superior part of the duodenum. Superior part of the duodenum. First part and second part. Lesser omentum. Gallbladder. Right colic flexure. Right transverse colon. Right part of the transverse colon. Right kidney. Yeah? You see, there are many structures that these organs have a relationship with the liver, the visceral surface of the liver. I told you liver is covered by the visceral peritoneum. Yeah? It's covered by the visceral peritoneum. This visceral peritoneum on the anterior surface of the liver and superior surface of the liver has a two-layer fold that attached to the anterior surface of the abdomen, anterior wall of the abdomen. This peritoneal fold is called falciform ligament. Falciform ligament. Falciform means mangel-like. Mangel. Yeah? Falciform ligament. In the inferior border of the falciform ligament, there is a ligamentum teres hepatis. In the adults, there is ligamentum teres hepatis, or round ligament of the liver. Ligamentum teres hepatis. Ligamentum teres hepatis before birth was umbilical vein, left umbilical vein, and after birth becomes ligamentum teres hepatis, obliterated and becomes ligamentum teres hepatis. This is falciform ligament. Here is falciform ligament, and in the inferior border of the falciform ligament, there is ligamentum teres hepatis. You see here, visceral peritoneum, after covering anterior, right, and superior surface of the liver, attached to the inferior surface of the diaphragm, and make reflection to the inferior surface of the diaphragm. This part of the peritoneum, between superior surface of the diaphragm and inferior surface of the superior surface of the liver and inferior surface of the diaphragm, is called superior or anterior coronary ligament. This is anterior coronary ligament. Anterior coronary ligament divides into the two parts via falciform ligament. There is a similar posterior coronary ligament. Okay? You imagine? You imagine this is a diaphragm. Okay? This is diaphragm. And this structure is the liver. This structure is the liver. A part of the liver attached to the diaphragm. Yeah? And you imagine this is visceral peritoneum that covers inferior surface, anterior and superior surfaces of the liver, and then reflects to the inferior surface of the diaphragm and anterior surface of the anterior wall of the abdomen. And this one is posterior layer that covers inferior surface and then reflects to the inferior surface of the diaphragm and posterior wall of the abdomen. This area is called subphrenic recess. And this area is called hepatorenal recess of the Morisot. Yeah? And here is Bayer area. Here is, this area is called Bayer area. Because peritoneum cannot cover this part. This part attached to the diaphragm. This reflection of the diaphragm, this reflection is called superior or anterior coronary ligament, and this reflection is called inferior or posterior coronary ligament. Is it clear? Is it clear? Yeah? This is superior coronary ligament and this is inferior coronary ligament. Anterior coronary ligament or posterior coronary ligament. Between them, this area is called bare area. Okay? Or posterior surface of the liver. On the right side and on the left side, on the both sides, superior or anterior coronary ligament and posterior coronary ligament or inferior coronary ligament attached together on the right side and on the left side. And this attachment makes triangular ligament, right triangular and left triangular ligaments. You see here, this is anterior coronary or superior coronary ligament, and here is triangular ligaments. Right and left triangular ligaments. Okay. The liver is divided into right and left lobes by the falciform ligament anterosuperiorly and the fissure for the ligamentum venosum here and ligamentum teres on the visceral surface. The right lobe of the liver is largest lobe, whereas the left lobe of the liver is smaller. I told you anterior to the porta hepatis, between ligamentum teres hepatis and gallbladder, this lobe is called quadrate lobe. This lobe functionally is related to the left lobe of the liver. Quadrate lobe functionally is related to the left lobe of the liver. And I told you between sulcus for the inferior vena cava and ligamentum venosum and posterior to the porta hepatis, this lobe is called caudate lobe. Caudate lobe. Functionally, caudate lobe separate from the left and right lobes of the liver. Okay? If you remember, I told you anterior part of the caudate lobe has two parts. Papillary process and caudate process. The caudate process attached to the right lobe and is located superior to the Winslows foramen, epiploic foramen. Here is caudate lobe. Caudate lobe. Here is papillary process. Here is caudate process. This is ligamentum venosum. This is ligamentum teres hepatis, round ligament of the liver. Here is gallbladder. Here is inferior vena cava. Yeah? Posterior to the left lobe, there is relationship with the esophagus. Here. And inferior surface of the left lobe has relationship with the anterior surface of the stomach. Stomach. On the inferior surface of the right lobe, posteriorly there is relationship with the right kidney and suprarenal or adrenal gland. And here is relationship, has relationship with the second part and first part of the duodenum. And anteriorly, there is relationship with the right colic flexure. Right colic flexure. posterior part and anterior part is here. You see here, bare area or posterior surface of the liver. Here is depression for right kidney, renal kidney depression. And here is colic impression. Here is posterior part has relationship with the suprarenal and right kidney. Here is esophageal impression, and here is gastric impression that you see. Okay, do you have any question? Do you have any question about this? Okay. If you remember, I told you celiac trunk emerges at the level of T12 from anterior surface of the abdominal aorta and divides into three branches. Left gastric is the smallest, ascends supralaterally and enters into the left lesser omentum, left side and to the lesser omentum. Near to the cardia of the stomach, it has a branch that is called cardioesophageal branch for blood supplying the inferior 1/3 of the esophagus and cardia area of the stomach. Left gastric artery has anastomosis with the right gastric artery. This branch is called splenic artery. Splenic artery is the largest branch, and you see it has spiral manner, spinal course on the superior border of the body of the pancreas, and then before entering into the hilum of the spleen, divides into many branches, and from this splenic artery, there are many arteries for the pancreas, for the posterior surface of the fundus of the stomach that is called short gastric arteries. And there is a large branch that is called left gastroepiploic or gastroomental artery that enters into the greater omentum and makes anastomosis with the right gastroomental artery. Third branch of the celiac trunk is called common hepatic. Common hepatic artery descends on the right side and near to the first part of the duodenum, divides into two branches. Hepatic proper artery and gastroduodenal artery. Gastroduodenal artery descends posterior to the first part of the duodenum and makes superior pancreatico-duodenal artery or superior pancreatico-duodenal arteries, anterior and posterior. And right gastroomental artery. Right gastroomental artery makes anastomosis with the left gastroomental artery. Okay? And hepatic proper artery enters into the free border of the lesser omentum. Lesser omentum on the left side of the common hepatic duct and anterior to the portal vein. This artery ascends, and right gastric artery is a branch of the hepatic proper artery that enters to the lesser omentum and makes anastomosis with the left gastric artery. Hepatic proper artery divides into two branches, right hepatic and left hepatic arteries. And these two arteries enter into the porta hepatis. From right hepatic artery, a branch emerges and goes to the neck of the gallbladder. And this branch is called cystic artery. Cystic artery. If you remember, between cystic artery, common hepatic duct, and cystic duct, this triangle is called Carnot's triangle or cystic triangle. We remember this is Carnot's triangle or cystic triangle. Okay? Right hepatic artery, from the hepatic artery proper, a branch of the common hepatic artery, and common hepatic artery is a branch of the celiac trunk. And left hepatic artery is similar. You see here, this is gallbladder. Gallbladder is a pear-shaped organ, pear-shaped sac, lying on the visceral surface of the right lobe of the liver in a fossa between the right lobe and quadrate lobe. It has three parts: fundus, body, and neck. Fundus, body, and neck. Here is fundus. Fundus of the gallbladder is a rounded end which may project from the inferior border of the liver. In the fossa, body is a major part of the gallbladder, which may be against the transverse column and the superior part of the duodenum. And neck is a narrow part of the gallbladder with mucosal folds forming the spiral folds. This is gallbladder. I told you arterial supply to the gallbladder is the cystic artery. Cystic artery is a branch of the right hepatic artery, usually from right hepatic. In some cases, maybe cystic artery is a branch of the hepatic proper artery. The gallbladder receives, concentrates, and stores bile from the liver. Okay? This is gallbladder. And here is cystic duct, here is common hepatic duct, and here is common bile duct. Okay. Do you have any question? Do you have any question?